Yes.
Oh, fantastic. Should have done it earlier, but that's okay. So I think the most important part is that we are all here today to see how we can work it better. And that's probably the most important aspect. So nursing jobs in the UK, you can see the slides now. Yeah, like that?
Yes. Yes. Yes.
Fantastic. So coming back, why? UK is a place which, well, I mean, in those days, UK and USA were the only two places. I did my graduation, post-graduation from India originally. Then I was the youngest assistant professor there after doing senior residency. Did it for 5 years. And then I thought there is nothing else. I was one of the rare young budding research fellows. So there were 8 people in the UK and 8 people in India who started this Royal Society project, and I was involved in that. So I have done the research, I have done the teaching, training, all kind of stuff. I was in the regional institute. But when you read, you find that you have a desire to be in a place where the top or cream of the world lives, work, do the research. So I came to UK and worked with all those professors and elite people whose chapters and research papers we used to read when I was in India. And that is a great fulfillment. That's a great opportunity. So I think that was one of my reasons to come here. In fact, that was the driving force. The important thing is that when you come to that, you need to think what is your reason. That was my reason. So coming here, I just said that I have just not come here to get money. It was much more than that. Professional excellence was my dream, and I have been successful, as you heard. Chairing Royal College Specialist Committee is rare. I chair the Regional Council of BMA, which is British Medical Association, Regional Consultant Committee. I chaired the uh, Education Committee of British Society of Pediatric Gastroenterology, Hepatology, and Nutrition, which is again a rare charm given. I am chairing the Yorkshire division of BAPIA, which is British Association of Physicians of Indian Origin. I chair the local negotiating committee, and you know that in a place which is predominantly white, for an Asian or Indian person to chair the committee is not easy. But now things are changing. As you know, the Prime Minister of UK is a person of Indian origin. So although we are British passport holders, we still have genes from India, and therefore the opportunities are there, and in fact they are better and more. And as Aniket mentioned, that there was a time the preference has to be given to UK nurses first, then preference needs to go to the people who are from Europe, and then to anybody else. But now with Brexit, which basically means that Europe and UK, within UK, we can employ people from outside. So going back, why UK? So UK is a popular place to settle, and you know that you can go to Middle East, but you will stay in Middle East as a foreigner forever. While if you come to UK after 5 years, you can apply for permanent residency and you can become UK citizen, and you can feel that it's not just you, it's your whole generation, your family, your children, who you can afford to send to universities like Cambridge and Oxford. You cannot dream to send from India. There's plenty of support. There is acceptance of people from India here. It's a free healthcare system. There is only one country which provide a free healthcare to the point of care, and that's UK. Everywhere else, you have to pay for your healthcare. So this is that place. There is bustling cities, fast pace. This is fantastic place. It is centrally placed in the whole world. There is Far East, there is Middle East, there is UK, there is USA. If you take the whole map, you have the North America on one side, and you have the Asia, which is like Japan and Australia on the other side. Middle East, UK. So it's very centrally placed. It's easy transition, and then there are places which are worth visiting, worth seeing, beautiful, stunning, and beaches and whatever. I know Australia has good beaches, but more importantly, the quality of life is what you need. In India, there is a lot of progress, but your quality of life is not as good, and you need to experience that to come here. More importantly, safety. Life is not still safe. You are going accident on left, and then you are gone. There is no following of signs. So there are a few things. I'm not saying that India I love still. I've been India just recently in Pravasi Bharati Divas, and I'm secretary of PIOCCI, which is the person of Indian Origin Chamber of Commerce. So we organize a conference before Pravasi Bharati Divas for whole day research university. So the idea is I love India and I love to support Indian people. So coming back here, so there is high demand for nurses in the UK. According to RCNC's Royal College of Nursing, 38,000 nurses were short last year. I know quite few in our own hospital. We got 200 nurses, and many other places. So it's increasing the presence of the nurses from Indian origin, but it's still a big shortage. And the part of the problem is that as we are getting more, there are still nurses retiring. It's a stressful job, and you know the doctor nurses here are very, very different. You take profession very seriously, and the patient's safety is prime. No negligence is accepted, and therefore, for the quality care, you need to be really careful on what you do. And because based on that, the demand is going to increase, and around 108,000 nurses are probably needed till 2027, according to the Royal College of Nursing. Especially now, the demand for the specialist nursing roles is increasing, oncology, mental health, palliative care, etc. And we'll talk about nurses have a good career pattern. Somebody has got, can
Sorry
please
to
people keep
interrupt,
them mute?
Dr. Gupta. Can you please keep your phones or laptops on mute, please? Please, this is a housekeeping rule request for everybody. Sorry. Please
Thanks,
continue.
Snigdha. Uh, yeah, everybody can hear me now, well. It's okay?
Yes, yes.
Fantastic. So we'll come to it. This is a place where you can have a career ladder up, and you can have a open conversation. So India is hierarchy. Doctor says, nurses do, and same as patients do. Here, nurses are equal part of the team, and nurses say, and they have open discussion. Nurses' opinion is asked in the multidisciplinary team. Galaxy J8. Thank you. So that's really very valued profession. And you can go up, you can become nurse consultant. Here the nurses do the endoscopy. For people who know, like camera tests they do, so they do, and they are independent nurse consultants. Same as diabetes. Just like doctors, nurses do the clinic, they advise the treatment, they write the prescription, they do everything. So the career ladder can go up, and same is in the management cadre. The oncology nurses, we have got pediatric nurses. There are nurses who do same job as doctors if they are in neonatal unit, if they are advanced nurse practitioners. So there is a big scope to go up, and I think this gives a lot of satisfaction, because in India you will retire as nurse who will continue to just carry on the, I don't want to derogate, but the instructions given by the doctor, and you will probably stay there. So the third part is that Indian nurses are highly valued in the UK because they are known for their compassion, their dedication, their culture sensitivity, and This is highly valued quality in the UK health system. Plus, Indian nurses have got lots of experience. They are able to do in high pressure environment, and they are valuable asset to the UK healthcare team. So this is a place, unlike Middle East, they are very valued part of the team, and they produce very good quality result. And therefore, you will be highly respected if you come to UK. So that is kind of my view. Then come, there are huge number of differences between India and UK. Expectations are different, training is different. I have been in India. I'm a doctor for a decade, and I know what it means to be doing the job of nursing, the training of nursing, and I have been here for almost now 2.5 decades, and that is very different. And what we are trying to do is also bridging the gap, because nurses there just carry the instruction, giving the injection, all that. But that's different. In here, nurses are supposed to think. You can refuse to give a treatment because you have nursing council registration, and your registration will be cancelled if you give wrong drug. It's very serious, it's very strict, and therefore you are given more rights. Same is, as I mentioned, that you can go up in the ladder, but also there are things like safeguarding, care, leadership. Nurses can become leaders, so it's a lot different role, and nobody can shout on you here. Nobody. If anybody shouts, you just report, and that's done. That person will be investigated and seriously taken about. So you are an individual on your own. There is system of safeguarding, clinical governance. There is a system of how you do the things. So there are protocols and guidelines, and everybody, whether you're doctors, nurse, healthcare assistant, anybody, you all follow that. So this is very unique and very important, and therefore we, through our Indo-UK collaboration, are trying to help improve the standards of care in India, and also train the nurses to UK standards and bring it here so that they feel valued, respected, and cared for. Now, I know a lot of people ask this question to me. The salary of the nurse is usually they are brought on band 5, and we'll talk a little bit more about it. And you can go up as you do more work and apply for nurse educator role, practitioner role, and nurse consultant role. You can go 24,000 to 40,000 and up to 60,000 a year. And there is annual rise in the salary, 3.5%, and recommended by the Nursing Midwifery Council. And there are highly paid roles as you go up. And I mentioned nurse, clinical nurse specialist, nurse practitioners, and nurse consultants. So there is plenty of job opportunity, plus job satisfaction that you get, and you can't get it anywhere else. But also life is very safe here, and there are no disturbance by the politicians or anybody else. Everybody gets the same treatment. You know, Boris Johnson, the prime minister, was admitted, was treated by the nurses, and he was so thankful for them. And this is how it should happen. So there are other important aspects is training and developmental opportunities. So NHS offers a range of postgraduate courses for nurse, and it's all free. You can do master's degree, you can do advanced practice, clinical research. As I mentioned to you, the nurse practitioner course, you can do it and you don't have to pay anything. It is the NHS who will pay for it. Also access to mentorship program, coaching program, clinical supervision and support. And these things do not exist in India, I know. They're starting some, but it is far more advanced here. So I just wanted to say, obviously UK, the world renowned hospitals and research centers, and you have opportunity to work. These are state of art facilities and equipment. So the next thing is commitment, sincerity, and diligence. This is what we are for, and we support Indian nurses for that. Highly qualified. professionals, and the UK government want dependability and reliability, and they pay for it, and they are very keen now on Indian nurses joining us. We have diverse population and healthcare setting, and this is extremely good. And we are trying to bring equality. I chairs the race equality and inclusion network here, and we are bringing parity. And there is support for you guys. So we are not here just to bring a recruit and take the recruitment fee and go away. We are here for you for rest of the life to help future promotions, future coaching, what opportunities are there, and this nobody else will be able to provide you. Comprehensive benefit packages, the pension, the generic values, the flexibility, and well-being. Your own well-being is looked after, and that doesn't exist anywhere else. So just we are coming to few more things before we come. So recognition of UK nursing qualification is all over the world. So in case you do few years and you think you can go anywhere, that's actually quite important. So just to summarize, high demand of the nursing skills, value placed on Indian nurses, highly competitive nursing salaries, training and development opportunities, world-class hospital and research institution, diverse healthcare setting, comprehensive benefit packages, and international recognition. So when you do it, so that's it. Now we come to the next part, what you need in order to be here. So first is IELTS or English test, because you need to prove this is an English country, England, English is a requirement. So you need to prove that you speak good English. So there are two tests. One is English test called IELT, the International English Language Testing, and you need to have minimum score, which is like 7. And then you have OET, which is Professional English Language Test, and you need to have certain score, which is grade B, and I think C in writing. Probably, I think there is one of the area in IELTS you can do 6.5, but I think preferably because you need to be a good person, you need to be respectable. So that's first requirement. The second requirement is computer-based testing. Now, this is a test which is knowledge test. So there are 120 multiple choice question, and we can help and guide and train you how you can pass this test. You can do this test while you are still in India. And once you do it, you can apply for the registration of the Nursing Medical Council. It's a theory test. It's easy. It tests your professional values. It tests your clinical skills. It tests your ethical issues, because ethics is very high in UK. Anybody who dies, there is big investigation. Everybody is looked into, and it is a serious event. So people need to be very careful in what you do, and therefore Nursing and Midwifery Council is very keen that everything is tested in terms of knowledge. So that's first part. Then we talked about the PLAB. You need to, yes, so we talked about CBT. So we directly jump into, after you have done, we will arrange for your interview with one of the NHS trust via Skype or a video platform. And this is an opportunity for you to prove that you are a good fit for a nursing role in the UK. And by this time, we will train you for the interview, what questions are asked, what is the process, and how you can succeed in the interview. If once you succeed, then we will arrange for your visa. But throughout the process, we need all your documents, including your CV, and we will help you writing what type of CV is more successful, the NHS application form. Then obviously police check needs to be done in your home country, which is India. And I'm pretty sure NKG and Snigdha can help you. And I believe Karna is having a good position. He would be able to really get it through much easier, because everything is a process they would do. We need proof of address document and references, and we will tell you what kind of referees are good and what type of reference do we need. We can help and guide you. Once then happen, then and you are selected, then we will have the NHS apply for your certificate of your sponsorship. So NHS Trust who has selected you will be your sponsor, and we will work with them to apply for your visa or course. So visa actually is to be applied in India, but this is certificate of sponsorship based on which you can apply the visa. You will have the visa for 3 years initially, and then if you once you are here and you work here for 5 years, you can apply for permanent residency. So after that, the other big hurdle is OSCE, or Objective Structured Clinical Examination. That's a practical examination. So we talked about the computer-based testing of your knowledge and um, ethics and skills, etc. But this is the practical exam, and it happens only UK. The CBT you can do in India, but for OSCE you need to be in UK. Now, some hospitals try and train it, but we can arrange for your OSCE training in India. Therefore, you are at your home country, you are comfortable, you learn better, and we can train you so that you pass. And the reason is that this is a very clear scenario-based testing, which will be in UK conditions. So you need to be good and familiar with the UK condition, and you need to pass the station. And these stations are very much like you need to be of standard of a UK nurse. So you remember that through bridging the gap, we will keep your knowledge, but where the gaps are, we will bridge the gap, and then you will be able to pass the OSCE. And the reason is that you have 2 attempts to pass the OSCE. You can get a 3rd attempt on your own expense to pass, but if not, then you are deported back to your home country even after your arrival. And you do not want to be in that position. You really want to come here, and earlier you pass, straight away your money go up. Although there is some money given to you when you arrive here, so that covers your expenses, but you will not be on full grade 5 or level 5 course of the nurses when you come here. So therefore we pass this OSCE and we prepare and we recommend you do it well. Once you pass the OSCE, you will be a registered nurse in the Nurse and Midwifery Council called LMC here. You are given a PIN, which is necessary for you to work as a registered staff nurse, and that allow you to work with confidence. So this is the whole journey. And after that, as I mentioned, we will give you some help to do more. But once you perform well, then I think that's good. We are here for many, many years. We are all going to help. And the big advantage is now we have got the whole like end-to-end process of support. So you got Snigdha, you got NKG there, and Colonel, and many other people who are going to help and support you while you are in India, and we will support you when you are in UK. So it's all a seamless process, and we have our vested interest in improving the quality of work within the NHS. So that all insight and support we have, we will give it to you to help. I think that's all from me now, and I am happy to take some questions at this point in time.
Thank
Was
you,
it helpful?
Dr. Rajeev. Yes, absolutely. And I also have got few questions from the audience. So the first question is the IELTS.
Yeah.
Has it required to be academic one, or the general IELTS would also help?
Generalize is fine. Any IELTS is fine.
Right. And
And Dr. Sir, we need to explain on the band as well. What band they're expecting in reading, writing, and listening.
Yes. So let me see. So
I think that was mentioned on the presentation, Aniket, 7 in each.
Yeah,
And
7 in each is good. One of them you can have 6.5,
Yeah, I
let me
think
just,
reading was 6.5, listening and speaking was higher.
yeah, correct. I think that's it. So 7 in
I
reading,
have one
speaking,
question.
and listening, and 6.5 in writing. Acceptable.
And I have one question, though it is not there in the, yeah, so somebody has asked. So is it only IELTS or PTE would also work? Because universities in UK do
Uh,
accept PTE or
no,
TOEFL.
OET, no, not TOEFL. OET is the other one, and OET is
So
a English proficiency test only for professionals. So IELTS is any IELTS, engineering, whatever, I don't know, manage, whatever, anybody. English test is same IELTS, but OET is based on professional. So if you are working as a nurse and you want to do that, this English questions they ask is related to your profession. So it's much easier to pass OET than to pass IELTS. The only difference is OET fees is slightly higher compared to IELTS, but the pass rate is much higher because OET is your professional English, which is much easier.
okay, so what Dr. Gupta is saying, that if the student takes up IELTS, the IELTS cost appearing is 15,000 something, whereas OET is 30,000, which is half of fees for a peer. But the comparative analysis in terms of the toughness, IELTS is tougher to clear and get 7 in each, whereas OET with the grades that is required, I saw it B plus, B and C plus, B in reading and C in other elements would, would be okay. So if anybody wants to take it, that could be done. The question over here was, Dr. Gupta, that there is a equivalent to IELTS, which is Pearson test in English, which is very popular amongst the students nowadays from India, apart from TOEFL. So PTE and IELTS are of the same category. So would it be acceptable if they take a PTE rather taking IELTS?
People are saying it. It is not typically approved by the nursing council.
Okay.
There are some people who are trying to add. I would probably recommend not for it, although for some profession it is taken, because it is not preferred test. I can inquire more about it. I know some previously it was rejected, so I will personally not recommend it.
Okay. The next question is from Arnav. Is there any references? So would you need a reference letter from their college professor, the nursing college professor, because BSc nursing is required?
Yes, so there are two things here. One, you would need your nursing college or nursing council checks. So you will need to provide their details, and there's some certification you need. And also they will write to your nursing council just to double check you are a qualified person, because you know that if an unqualified person can come from India with all different means. So I think that's first. But also you need referees. So these references are from people who are reputable. So yeah, correct, so whatever. You talk to them and they can provide, this is called structured references. So they write about your knowledge, they write about your skills, they write about your talent, they write about your ability, they write about your communication skills, they write about your interpersonal abilities, they write about your team working, they write about how you keep the patient's care, your compassion, etc. So they write it, and that is taken as a plus point, because at this point we are believing in you, we don't know much about you. So this is a triangulation. So we get your proper papers, we talk to you, but it's a short interview, we don't know all about you. So this is the third dimension, that they write about you, and we kind of do a triangulation to just satisfy ourselves that yes, you are good grade.
All right. Thank you so much. So we need reference letter from their college. Is that I'm saying we are getting the information? And how many reference letter is required? Is only one or two?
two
there is any
reference
typical
letter. You
number?
can have it from your college, but also from the place of your work where you're working, and because they know what type of care you are providing, how you care for patients, etc., etc.
Galaxy B, could you please mute your mic? Galaxy's JB, please mute your mic. Thank you, Professor. Thank you, Dr. Gupta. Any other question anybody would like to ask? So.
Somebody has questions.
Okay, the next question is work experience mandatory? And if yes, then how many years?
So the work experience we need is 12 months post qualification. So post qualification, 12 months experience is required. I know some people says 6 months, but that's not correct because you go into process. So in theory, you can start applying, and by the time you complete everything, it needs to ideally we need 12 months post experience.
Dr. Gupta, can you please from your end mute Galaxy J8 because I'm not able to do it from here.
I am doing it here now. It's done.
Yeah, thank you.
Any other question?
1 year work experience is required, and I believe it is BSc nursing. Will you accept ANMG? It is only BSc nursing.
Ideally, it should be BSc nursing qualification, but I mean, there is a scope. If they have done more work, it can kind of compensate.
Okay, so ANM GNM, which is also kind of 2 years with more work experience, could be acceptable for this program. That's a good news.
Correct, because you can't guarantee, but you can try and compensate that.
Right.
This, and we can arrange for some certificate. It will need further discussion, but if they have done this in addition, then we can try and work it.
All right, that is good. The next question is, will they get multiple chance to clear the, I believe the exam they are asking about is about the OSCE. So how many attempts would it
get
require?
2 attempts, and then they can have a third attempt. So maximum 3 attempts.
3 attempts. Okay. And what would be the processing time from application of NHS? So if they get IELTS, this is what I am understanding, and Arnab, if you want, please add on your comments. So what I'm understanding is while they clear the IELTS, they have 7. And so how much is the processing time from the NHS in terms of their, the offer letter or confirmation of sponsorship and the visa processing? Is that what I think she's asking? Yes, he's asking the same thing.
So I think generally depend on how quickly you process at your end. Usually it takes around 6 months because everything needs to be cleared. They need to write, you need to do registration, they need to have your own police check, clearance, discussion, and all paperwork with your NMC, your regional council, the issuing of the cause, which is the certification of sponsorship, you coming, clearing, passing, every 6 months is generally there. But if you are having some difficulties and your nursing council is not replying, then it is just going to take. And I generally recommend you go there and make sure all your paperwork is there. Sometimes it has even happened for some we wrote and they said, oh, these all papers, all they have been washed away in rain. So we don't have any record. Can you believe it? So it's one of those things. So we recommend you clear up, and average is that. You can even be faster, but I think that's there. Sometimes it's slower. So somewhere 6 to 12 months is what I would recommend.
Okay, so 6 to 12 months, usually it is in between that they would get everything done. And that's why I think you're recommending for them to clear the OSCE training here itself. So that could cover the gap, and they can
Faster.
easily be recruited there on a higher pay scale. Is that what I'm getting the idea, doctor?
Yes, exactly. So when they come here, they would be offered some, but you can't get the proper grade unless you are registered. You can imagine you are applying for a registered nurse post, the staff nurse,
Mhm.
and you need to get on that grade. You need to be a registered nurse with the nursing council, and they cannot register on the nursing council till you pass OSCE. So if you pass the test, then you get it. They would offer you some lower grade, but that's what I would recommend. Thank you.
All right, great. I think somebody's trying to say something. Okay, yes, I get your hand, but no,
Is it who is that?
you need to unmute yourself, or Redmi 9. Could you just unmute?
Yeah,
Please.
Yeah.
yeah.
Hi, Stanley.
I just joined about 5 minutes later when the presentation started. I just want one basic question. What is the maximum age cap for the nurse to be recruited?
There is no specific age cap. It depends on where you are, what you have done, and your profile. So I wouldn't say there is a specific age cap, but yeah, if you're 60-year-old and you want to come here, people will be question mark why you're coming.
Okay.
Because you need to have
So
some
can we-
productive professional life in the UK. We're calling you here into UK to do the work. We're not calling you to come and retire next year. No. So there is no specific,
That's
but
right.
you need to have a long enough life to do the professional work.
So can we put from ourselves, I mean, a cap of maybe looking at 35 be the maximum, Dr. Gupta?
I think that's probably reasonable because then you need to do all that. So I think probably that's reasonable.
Right. Stanley, I think your question has been answered.
Yes, madam. And one more thing. I'll be happy this PPT is being shared with us. We can go this contents one more time. Get ourselves more familiar with all the facts what doctor has spoken to us.
We have recording, so we can share it with
Please.
you, Stanley, for your knowledge. And definitely we will keep doing this seminar soon. So you can join the next one once you go through with your recording, and you can questions that you have, and that you can get an elaborative answer when you join the next session. Now, again, I get a new question. Can they take their dependent also, doctor?
Correct. So they can bring their dependent here. So first they need to do all the paperwork, complete it, get the course, get the visa sponsorship, come here, and then they get the job, then they can call the dependent. Some people have brought the dependent in their own expenses here, and I know a few of them did not pass and they were deported back, or they had teething problems, partly because we were not their sponsors. The recruiters took the recruitment fee and then just left. They did not provide support. And this is a country where you can imagine you're working with white nurses and you are getting the same salary. They says you should be equal to me. And therefore it did cause problems and the depression and all that. So they've gone back. And so I would recommend that come, we will help you settle, then get your dependents, and that way you can find your place where you want to go. If you're their children, they can find the right school for children, and that would be a much easier and a better way to come here. But to answer the question, they can definitely bring their dependents here.
Great. That was a very informative session, Dr. Gupta. Any other question? Captain sir, any other question from your end or the team?
I think all the questions have been answered. Thank you for the inquiry. It was quite elaborate and quite educative.
Thank you, sir. And Aniketji, would you like to talk or say something as we are now concluding the session, I believe?
Yeah, I think where these people attend, thank you for attending the seminar. And as we discussed, Nigdaji, soon we will launch the batch for first
Mhm.
training for NHS because recruitment keep
Mhm.
coming. So those who are interested nursing candidate who wanted to join for UK, they should be in touch with their sources from where they joined this seminar. We can get them into our next batch immediately. So they will get an opportunity with interview with NHS as early as possible. That's what I need to ask. Thank you, Dr. Gupta. Thank you, Snigdajan. Thank you, Captain Sir.
All right. Thank you, everybody, for joining the session. And thank you, thank you, Dr. Gupta. It was really pleasure to have you here. And we would like to have more sessions by you so that we can explore, we can actually educate the, country and the nursing community well versed with their opportunities lying down, not only in India, but outside India. And that is typically to UK.
Lovely.
Thank
So
you very
nice to
much. Thank you.
Thank you.
fine. Lovely. Nice to hear you all guys. Have a great day and we'll catch up again. Bye for now.